So what inspired the formation of The Equitist?
It's the epitome of doing too much, isn't it? Sandra? I know it is. I've known for a little while. I think even while I was at Harvard, because I told you right after Harvard, I had a short stint of consulting, and it was like real kind of not organized and unofficial, and I only had like one client, which was really great. But I've known for a while that I have an interest in eventually working for myself. And it was just a matter of figuring out like when would that happen. So I didn't think it would happen this soon. I'll say that first and foremost. um, but at the beginning of COVID, I should say, I was in a role that was not directly serving in public health. So I was actually at Times Up. So I was working for Times Up Healthcare, and I was a little kind of like, oh, like why? What is with this timing, right? Like I just left a position where I would have been like right at the helm and like helping to make decisions and all of that. And this is the moment literally that I feel like I have trained for, from population health to policy to operationalizing health equity on the ground to working with communities. I was really sad, quite frankly, about where like how could it be that I was not, and I was glad to still be at Times Up, but how could it be that I wasn't where I thought I should have been for this like once in a lifetime emergency that I could have really helped with. So at the onset, I knew that this was going to be a really big thing. This is going to disproportionately impact communities of color, that public health leaders are going to need help as states were declaring emergency, and that ultimately they did not know, because I just worked in state government and then there was no real guidance from the federal government. This was going to fall in the hands of states. And that because I just worked in state government and specifically at a health department, I knew people aren't going to know how to operationalize health equity in this moment. So I said, I'm going to start my company. My boyfriend helped me do the paperwork. He is a serial entrepreneur, so thank God that he knew how to do everything real quickly, because I was like, I don't know, I just might have a title. That's all I can give you. So we put the paperwork together, and 2 weeks later, I got a call from a cabinet member in the governor's office in the Commonwealth of Virginia saying, like, we need your help. We need your help with health equity. We need your help. And I was like, okay. Just so happens I've just formed a new company and you can be my first client. So that's how it started. And we have been working to literally operationalize, as in at the height of COVID, worked with the Department of Emergency Management and several other agencies in Virginia to move masks and hand sanitizers to the doorsteps of the people who need it the most. We distributed over 1 million masks, over 900,000 bottles of hand sanitizer across the Commonwealth to the doorstep, not asking people to come out to an event, not asking, not just putting it somewhere and just whosoever shall come, not shipping things to localities that we're just most comfortable with, but figuring out using data, where are those pockets where people cannot socially distance, where there are multiple people living in a household, where there are perhaps multiple underlying chronic conditions in communities, and bringing those resources to their doorstep. So been working with them for actually the duration pretty much of the emergency, as we're still working on things. But now have also shifted into working with specific clients to help operationalize and teach people what health equity actually is, and then how to think about infusing that into your organization. How do you do that in a legitimate and also sustainable way?